Previously on Bodies.
Rob Lake. Roger Hurley's new SPR.
Angela Strawberry. That's an unusual name.
She's in a fucking section, Donna. I've never even seen her cry.
You're the closest thing to a surgeon we've got right now.
I had the opportunity to do a crike and I botched it.
If you hadn't have acted, that woman would have died.
She did die. I've written up the post-op fluids on Winfried Bourne.
Aren't you the clever boy? Roger Hurley may be a good guy.
Slip of the tongue.
He's just not that good a doctor. Her heart stopped beating for a time. Her brain received less oxygen than normal. There are signs of brain damage.
I'm married. What happened shouldn't have happened.
Your baby didn't survive.
Did somebody make a mistake? Did somebody make a mistake?
I'm Polly Gray. I'm a specialist registrar in obstetrics and gynecology. I'm carrying out a research project into female sexual dysfunction. If I may, I'd like to ask you some questions about your level of sexual desire, arousal, and orgasm. When did you last have sex?
16th February 1977.
What's the strangest place you've had sex?
Up the arse.
I want to start the FSD trials on Monday.
No, we don't have enough patients yet.
How much money are Bing, Stornoway and Carol giving us?
A lot?
Yes, Polly. A lot.
It's not easy to find women who meet the inclusion criteria.
Stretch them.
My name's Polly Gray. I went through a questionnaire with you last month. My name's Polly Gray. I went through a questionnaire with you last month when you attended outpatients. You may remember I was researching female sexual dysfunction. No, there's no problem. I was wondering if you'd like to take part in a trial for a brand new drug treatment for the condition. Who knows, it could be a real boost to your sex life. My condolences. I'm sorry to have troubled you in your time of grief. Shit.
Excuse me. What's happening?
The body's still producing breast milk. I can prescribe her with a tablet to suppress lactation if she comes around. It might be easier for her. She's stable. Hopefully she'll recover consciousness in the next 24 hours. Did you have a name in mind if it was a boy?
Daniel.
Would you like him to be named? Would Karen like that?
Yeah, I think so.
Morning. Mr. Taylor. How are things?
How do you think?
Mr. Taylor, would you allow me to explain what happened? Your son was only 28 weeks gestation. His strength was compromised both by prematurity and the ruptured placenta, which caused your wife's bleeding. Karen's hemorrhage was severe. She bled so much that during the operation, she suffered a cardiac arrest. And for a short time, until we could revive her, her brain was starved of oxygen. I'll leave you with your wife, Mr. Taylor. If at any point you'd like to speak to me, please Ask the nurses to contact my secretary.
Excuse me. He's the reason she's like this, isn't he? I want something done about him. Who do I talk to?
Well, you can complain to the hospital. You can complain to the General Medical Council. First, you should speak to a solicitor.
Well, that's it. He just gets to carry on working.
It isn't my place to comment.
What did he say?
He's angry. He's upset. He wants to talk to a solicitor.
Who suggested that?
He came up. I advised him to think about it. Boss, I don't know what I'm supposed to tell him. I can't keep covering. Well, not covering.
Let me remind you of something, Rob. Not wishing to appear callous. A patient of mine, Mrs. Angela Strawberry, developed acute epiglottitis. You performed a cricothyrotomy. She died. I spoke to the family for you. I told them it was a tragic accident in which no one was at fault, and that's what they went away believing. I covered for you. Look, Rob, let's not fall out over this. If he wants to, I'll talk to him. If not, I'll try again. But no one needs to cover for anyone, because no one's to blame.
Oh, great.
Push for me, Mina. Here it comes. Push. 1, 2, 3. Mina, listen to me now. I can see the top of the baby's head. One big, long push, and it'll be on its way out. Can you do that for me? Mina, I don't want to call the doctor in. Do you want me to call the doctor in? No? So come on, then. Let's try for another. Push! I want to check how the baby's feeling about all this. Right, you have to get this baby out straight away from me. Do you understand me, Mina? Mina, the monitor shows signs that the baby's in distress. You've got to push it out for me. Do you understand? Come on, push! 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 I have to call the doctor in.
Should have been called earlier. I'm not taking the blame if this baby comes out a fucking muppet. Okay, Mira. Mina, on the next contraction, I want a nice big push, okay?
Here it comes.
Okay, now push.
Push, Mina! Push, Mina!
Bloody brakes, for Christ's sake. Push, baby, one more time, push.
You're doing it! You're doing it, Mina! You're doing it! Push! You're doing it, here it comes!
Christ, he's a bigger.
Good girl! You're doing it, Mina! Oh! There we go!
No wonder he got stuck. You know when that second stage delays go on that long?
I was trying my hardest to give her a normal birth. It's not just a medical procedure. Might be to you, but...
Is that what she said then? Don't call in the obstetrician. He'll be a nasty man who'll rob me of my birthing experience. How you doing? You have a name for the baby yet?
No, push those in. No. Ronnie.
Ronnie. Rest up, okay?
Sharing the same goals helps us achieve those goals.
good.
Fucking hell.
Right. Remembering there's no I in team, can we do the trust exercise, please? Can you get into 4 rows of 2? Facing the same way. Dr. Orton? Thank you. OK.
For God's sake.
Here we go. Karen, if you can hear me, blink twice, please. I'm going to ask you some questions. If the answer is yes, blink twice. If it's no, blink once. Do you understand? My name's Maria Orton. I'm an anaesthetics consultant. We're going to switch off the ventilator, the machine that's controlling your breathing, okay? We're switching it on now. It's good she's gagging because the sedatives are wearing off. Karen, I'm going to remove the tube from your throat, okay? It's perfectly normal to be frightened. I'll pull it out very gently. Be a kind of funniness. No pain. And then you'll be breathing normally again, okay? Mr. Taylor, this is perfectly routine. Syringe. Karen, I have very bad news for you. Your baby was delivered by cesarean section. But I'm very sorry. He didn't survive.
Mom! Got a photo of him here. Isn't he a beautiful little boy? I called him Daniel, like we said. Here's some prints of his hands, his feet.
I wish this case was the first. It isn't. I've compiled case studies of Hurley's negligent acts since his appointment. I intend to present it to the management. I'd like you to add your testimony.
I've just joined the rotation. He's my boss.
You write a letter. You set down the account of the Taylor case. You give it to me. I add it to my letter. And I send it to the O&G unit administrator.
You're asking me to blow the whistle?
Yeah.
No, I won't blow the whistle.
Oh, come off it, Rob. This isn't
Look,
school.
you don't go running to the management. Doctors deal with doctors.
Is that what you think?
There's the National Clinical Assessment Authority. They can assess him and retrain him. It'll be out of our hands.
And what would prompt the management to refer to the NCAA? A little bird tells them to.
No, but I'm telling you, I'm not prepared to...
Come off it, Rob. No one has lifted a finger about this. None of your predecessors, none of the other anaesthetists, none of his fellow
Wait a
consultants.
second, you come off it. You're asking me to write a letter and put my name to it.
We can't let this go on any longer.
We?
Fine. If you can ignore this case.
I'm not ignoring it,
If
Mary.
you can ignore this case, it won't be much longer till there's another one.
If this has been going on so long, how come you've done nothing about it till now?
I like your outfit. It suits you.
Thanks. Admin day.
Donna, do you have time for a cup of coffee?
I would, Maria, but I'm snowed under. It's...
Okay.
Is something the matter?
I'm pregnant again.
Oh, congratulations.
Thank you.
Oh, take a seat. Oh, how is it so far?
I know not to get my hopes up. I have, after all, a 30% chance of having another miscarriage. I'm worried about how I'm going to react if this goes wrong again.
There's nothing wrong with being sad when a sad thing happens to you.
You don't have to employ euphemisms.
Sorry. But whenever you need to talk, I'm here. Just between us. Okay?
Thanks. So, what about you? Any gossip?
No, nothing.
Back to work?
I'm worried. I can't do this.
So, tell me about female sexual dysfunction.
Some people think it doesn't exist. It's an invention by the pharmaceutical companies to cash in on the market for Viagra-like drugs.
What do you think?
I wouldn't like to say, since being stormed away, Carol are paying for the research. But some people think it's been going on for far too long. It causes a great deal of distress. It doesn't help that it's not as easy to define as the Horn of Africa, Italy, Korea, Florida.
What?
As a male erectile function. Horn of Africa, Italy, Korea, Florida.
Yeah, I get you.
In women, it's far more subjective than it is in men. It's levels of arousal, quality, quantity of secretions.
Ugh.
What?
Gynecology. I don't know, sometimes it sounds so veterinary.
Oh, you're a pig.
Naughty.
Rob, this is Mrs. Strawberry's son and daughter.
You here to see someone?
Actually, Mr. Lake, we were hoping to see you.
This way, please.
When you told me about my mother's death, we got the sense you were holding something back. Were you? Did you have any last words?
Last words. Well, she couldn't speak. She was dying.
Of course. Sorry.
What did she suffer?
Your mother's death was sudden, but for a short time, unfortunately, she did suffer, yes. I'm sorry.
Thank you for being honest.
Can you tell us your side of what happened?
Well, as you know, your mother developed an extremely dangerous throat infection called acute epiglottitis. This is where the throat becomes so inflamed that it blocks off the airway to the lungs. The only hope was to perform a cricothyrotomy, a procedure similar to a tracheostomy. I carried one out, but unfortunately it wasn't successful. I'm sorry.
Could anything more have been done to save her?
No, nothing more could have been done.
I'll never fuck up again. I'm sorry.
Mr. Whitman and Mr. Hurley, secretary. I'll get the notes and call you back. Is that to go today, Maria? I'll run it round for you if you like.
Would you, Marie? Thank you.
No problem.
Hi, Donna. How are you?
Fine, how are you?
Do you have a few minutes, please? I'd like to see the Taylors.
And again?
I'll just come and see you before my ward round.
We could go somewhere to talk.
Here's fine.
So could you excuse us?
Certainly, thank you.
It's nicer being on the ward. The ITU can be a bit impersonal. I'm deeply sorry about the loss of your baby. And I'm deeply sorry about your condition, Karen. Let me tell you more about what happened. Karen, you had an abruption. The placenta had come away from the wall of the womb, and there was a life-threatening hemorrhage. Your baby was only 28 weeks. His life was also in grave danger. At that point, I decided not to choose between them, not to work to save one at the expense of the other. I tried to save you both. I delivered your son by cesarean section. He was extremely premature and weakened by the problem with the placenta. We did everything we could to revive him, but he was dead. I'm very sorry. At that point, Karen was still bleeding heavily. I could have performed a hysterectomy. I could have taken out her womb, but this was your first child, and I tried to give you the chance of having another. Was I wrong? Mr. Taylor, if I had taken the womb straight away, your wife might not be in her present condition, but I chose to give you the chance to still be parents one day. She bled. She just bled and bled. I don't know why. And I had to take the womb. I'm really very sorry. I'm sorry for everything.
Are you all right, Roger?
Perinatal mortality runs at 1 in 75. On a unit this size, that's what, 50 odd a year? 1 a week.
Accidents happen.
Yeah. Look, give me a call if they need anything else.
Yeah, will do.
Thanks.
Wait. Zach's splashing in the bath?
Well, you used to splash the water when you were a baby. Yes, you did. You being a good boy for Mummy. Tobes, Daddy's got to go now. Bye. I love you. Bye.
Mr. Hurley, we'd like to talk to you about a serious matter. There's been some complaints about you from Dr. Orton.
Rob, I'm going to ask you a straightforward question. I'd like a straightforward answer, if you wouldn't mind. What do you know about Maria Orton's allegations against me?
Nothing.
Good.
What's going on?
It's bad enough we have pen pushers spying on our every move. Now it's an anaesthetist.
I'm so sorry.
That's all right.
Excuse me.
Okay.
Am I losing my marbles? Am I not supposed to be gassing for you guys today?
Not us.
Are you sure?
Yep. Bang & Olufsen. I like those, they're good. They're very good. The sort of stuff I listen to, you need a big fruity back end.
Why has my name been removed from the rota?
None of the surgeons are prepared to work with you.
That's preposterous.
Ask them.
The other anaesthetists will be up in arms about this.
Well, they don't seem to be. I think they feel as betrayed by your allegations as I do. As all the consultants do. Maria, if you had a problem with my methods, then you should have discussed them with me.
I tried over and over again.
Why are you doing this? Why are you conducting a witch hunt against me?
Dr. Orton, would you like to come with us, please?
Maria, no one regrets this more than me that this couldn't be dealt with doctor to doctor.
Hi, this is Mr. Lake and Guiney. I can't get an answer to Dr. Orton's bleep. Can you check the number for me, please? Orton. O-R-T-O-N. That's impossible. Why would she not be listed? Can you put me through to a secretary, then? Well, she had one yesterday. Is there anyone that can help me?
She's definitely a PP, so can you make sure that her notes get over to my secretary at Renfrew by tomorrow lunchtime latest?
Okay.
This week's OPD letters, one's a DNA, the fourth. I don't want to lose the follow-up. I'll have to do a quick GP letter. Can I use a dictaphone, please?
Use your finger like everybody. Are we ever actually going to get this new SHO, do you think?
A flight's booked. We're just waiting on a UK registration.
Oh, okay.
Mr. Whitman, sorry, is this about time?
Yep.
Can we talk later?
Well, I'm a little bit busy later. What do you want, Mum?
It's kind of delicate.
Well, all my staff are sworn to secrecy, I can assure you.
Maybe we could go outside the hospital premises. There's a pub around the corner.
I'm on call.
I'll buy you a Coke.
You're on call and you go to the pub. It really doesn't matter what you drink, Rob. Doesn't alter the fact that you're a doctor who goes to the pub while he's on call.
Mr. Whitman, sorry. What's happened to Maria Orton?
Silly cow. So, Hurley makes a few mistakes. What's he got to do there?
You've known all along. You just said Hurley makes mistakes.
aren't you gonna get that?
Not my job.
I could make your job much more difficult.
How would I tell the difference?
You would know.
They've suspended her, haven't they?
Mm-hmm.
What do we do?
Nothing. Do nothing. Say nothing.
What grounds could they suspend her?
They probably haven't decided yet.
Thanks for waiting, Rob. Right, let's whiz round, shall we?
Tim, you...
Thank you.
Tim,
Can I have a quick word, please?
excuse me, Dr. Sibley called me down to see a patient.
Yeah, just through there.
Hello, I'm Polly Gray. I'm the registrar. I think she's got an ectopic.
Oh, my.
What?
You're going to want to admit her, aren't you?
Ever so slightly.
Well, we've been commanded to get the patients out of the department, but we haven't got any beds to put them in. Come with me.
Let's keep good tea, thank you.
Knackers their figures to have patients stacked up on trolleys. So can your woman wait here?
On the corridor?
Well, it may look like a corridor, but it's actually been designated an observation area. As long as we screw the wheels off your patient's trolley.
The wheels?
Yeah, without the wheels, it's a bed. Unless you can get by with a chair.
A chair?
Hospital guidelines stipulate that a chair is the equivalent of a bed.
Okay, I want her on a trolley, with or without wheels, right here with those doors open, ops every 5 minutes.
Okay.
I'll send for her as soon as I can book a theatre.
Shit, bit of a mess in here, huh?
We've had to bring ectopic to theatre. I don't think we're going to make it to the routine lists.
What am I supposed to tell the patients?
Tell them to try acupuncture?
Yak, yak, yak. Polly, less gabbing, bit more stabbing. You're gonna have to open her up, I'm afraid.
Sorry, Kat.
That's 4 PCIs we've had clocked in. Bloods, ECGs and X-rays done, kept nil by mouth overnight. They are pissed off. I'm pissed off. It really pisses me off, Don.
Dear Dr. Sarawagi, thank you for referring this lady who has a 3-month history
Any more
of
cancelled
causal
ups?
bleeding.
2 more.
Clinical examination was normal.
You know your waiting list, Tony?
Oh, shit.
This one's been on it 12 months already. When are you going to get her in?
Find out when she's going on holiday.
Tony,
Oh, shit.
the unit administrator wants to talk to you about this month's cancellations.
I don't want to talk to her.
Shall I call her and say can't make the meeting?
When's the meeting?
Now.
Why didn't you tell me earlier?
You were busy earlier.
Shit.
I've been looking through the cancellations, and yours seem to exceed the average. If cancellations run high, then the hospital gets fined for not meeting targets, and that means less money for next.
We've had 6 operations cancelled this week. It's too many. Apparently, we could do better.
Well, the cancellations have already happened, so we'll just have to try harder next month.
Yes, but that won't have any effect on this month's figures, will it?
What are you saying, Tony?
Nothing.
Right.
The management expect a lower return on cancellations.
How much lower?
Well, ideally, none.
Are you asking me to falsify the figures?
Fucking 6 cancellations. Did you telephone that patient who was on the waiting list?
She's back to Bangladesh from the 5th to the 19th of next month.
Book her into my clinic on the 8th. She won't be able to come, which means the delay in treatment will be patient-initiated, which means it doesn't count against me.
Right you are, Tony.
Actually, something we could probably, Excuse me, just a minute, Mr. Burns. Mr. Lake.
Sister.
Mr. Burns has come up from the hospital mortuary service.
The bereavement midwife's off sick, so he wants to talk to the Taylors about the arrangements for their baby's funeral. I said it was something that we could do.
Yeah, okay. No problem.
Great. That's fine, Mr. Burns. We'll deal with it, thanks. That's all they need, a visit from Uncle Fester.
According to a recent survey, what percentage of mortuary workers admitted to necrophilia?
50.
70.
Maybe we should come back later.
No problem. I'm nearly finished.
This is a difficult subject, but we have to talk about Daniel's funeral.
Okay.
You can make your own arrangements if you prefer. That's up to you. But the hospital does provide a funeral service. We arrange it through an undertaker. And I'm sorry to mention money. Please don't be offended, but it is free. A coffin will be provided and he'll be buried near other babies.
There'll be a funeral service which you can attend, but he'll probably be buried in a multiple grave. You can pay for a separate grave and a headstone. The alternative is cremation, but it's unlikely there'll be any ashes for you to take home.
Why wouldn't there be any ashes?
I'm sorry, I don't know the reason why. We're just told to inform you of that. Sorry.
Okay, well, we'll think about it. Thanks.
Thank you. You okay?
I'm okay. You?
Me?
How do you feel?
Alive.
I forgot my period was due.
I suppose you can't call this a one-night stand anymore.
Don't want to call it anything. This isn't something I planned.
Something you don't want.
Just not what I planned.
Cleaners are gonna think I've slaughtered a goat or something.
Makes a change from you choking your chicken.
Is that what you think? I've got to tell you, sometimes it really is the only option.
Ah! Ow!
I'm starving. Let's find a restaurant.
I'm not hungry.
Well, we can go to a pub then. I'll be fine with a nice packet of pork scratchings.
I can't.
Why not?
You know why, don't ask.
We'll go somewhere where no one knows us. This hospital, this shitty room, I feel like I'm living in a box.
I'll worry if I'm late. Look, I'm sorry. I'm sorry it's like this.
gynae. Can I help you?
Mark Taylor, Karen Taylor's husband. Hi. No one fed my wife her breakfast.
Sorry, we're short-staffed today. Excuse me, sir. What do you think you're doing?
I'm looking for my wife's notes. We need them for the court case, the complaint, whatever it has to be.
You can't look at medical records without permission.
I'm not here.
Sir, I've asked you nicely.
Where are my wife's notes? Excuse me.
I need to book an urgent ultrasound, please.
Are those my wife's notes? My wife's medical notes should be here.
Excuse me. Hi, I need to talk to someone about an urgent ultrasound.
ONG, straight away, thank you. You can't come in
I
here.
want to know where the hell are my wife's medical records.
I've called security. Someone's on his way up right now.
If they're not on the ward, where would they be?
It is not my responsibility to find your
What's
wife's
the matter
notes.
with you? I'm asking you a simple question. What's the matter with you people?
If you just calm down, sir.
All I'm trying to do is ask a question. Now, are you all so powerful and I'm such a piece of shit that I can't even ask a question?
I've called security.
What about you? Do you know what's happened to my wife's medical records?
I'm sorry, I don't.
You're all such patronizing bastards. Do you know what happened this morning? My wife had her breakfast plonked down in front of her. And no one gave a shit that she couldn't feed herself.
Don't swear at me.
I'll swear at you if I bloody want to.
I'm calling security again.
Where are my wife's records?
He was upset about his wife's notes and about her breakfast.
They are no excuse.
No, they're no excuse.
You were not on. I was, and I am reporting it.
I'm on now, and I'm asking you not to.
Is that how you look after the nurses on this ward, Donna? So who comes first, us or the patients?
All I'm asking is for you to show some compassion. By all accounts, he only pushed you.
Then do I have to bleed? I have to have broken bones or...
Everything all right?
Yes?
How's her blood pressure?
Blood pressure? Yes?
Everything's okay.
Everything okay.
Okay. I'd define her disease as moderate. There are 2 spots on... Where's he going now?
Fuck knows.
Go and find out what he's playing at, will you? I'd define her disease as moderate. There are 2 spots on the uterosacral ligament. Can you see those?
Yeah.
Everything all right, Doctor?
Aviola. Abiola.
Everything all right?
I'm trying to buy a car, but it's already sold.
How long are you staying with us, Dr. Abiola?
I don't know.
Do you mind if I ask, where did you train?
Moscow.
Really?
Many students from Nigeria trained in Russia.
Have you always been a locum?
Yeah, see, always a locum.
Had the locum anaesthetist yet?
Say what you like about Maria. She was a decent guest, man. Same she's a bird, really. I'm afraid the new bloke is all yours, matey.
Who left these? I don't know. Don't know.
Dear colleague, I'm writing to you to clarify a change of work status. The post of consultant anaesthetist will continue to be filled on a locum basis. Dr. Maria Orton, who is a valued colleague, remains indefinitely on psychiatric sick leave. Psychiatric?
About 18 months ago, she had a miscarriage. She became clinically depressed. They're saying psychiatric to make out it's a relapse. Bastards.
Should we go somewhere better to talk? If they want to chuck me off the promises, let them. Oh, you mean for your sake? Of course, I'm sorry. It's okay. Donna, I'm thinking of going to the press.
Saying what?
That Roger Hurley was appointed based on his inarguably first-rate record on ovarian research and the funding that he attracted, but that no one ensured he was competent in the day-to-day care of obstetric and gynecological patients. That once his shortcomings became manifest, the hospital knowingly continued to employ him beyond his level of competence. That the hospital turned a blind eye and have no choice. They have to carry on doing so, as any charges against Hurley will inevitably raise questions about their failure to act sooner. I've agonised over this. But I've got to do something.
I want you to see this.
Bastards.
Maria.
Maria. Is that why you came to meet me? To tell me to give in?
No. No, I'm worried about how this will affect you. Patients aren't the only ones who can be victims of medical accidents. Doctors can be too.
What am I supposed to do? Let them take a career that I worked for, that I put off having a family for, that could have cost me having a family. No. No, no, no. I won't give in, Donna. I won't. If they want to fight, they've got one.
Grant this, O merciful Father, for the sake of Jesus Christ, our only Saviour, mediator, and advocate. Amen. Please accept my sincere condolences.
Thanks for coming. That's okay.
We've got a solicitor now.
Oh, I hope they can help. I've got to get back to work.
She makes call after call to the hospital. No one ever gets back. And then finally, someone tells her they've lost the notes. They say they can't find them anywhere. The solicitor, she says, without the notes, it'll just take longer, years. I don't know if we can't be sure of winning. I don't know if I can give months, years to a legal battle. The money.
I'm sorry.
I'm a school teacher. If one of my colleagues can't control his class, doesn't prepare his lessons properly, then I know it. But if a surgeon hasn't done his job properly, how am I supposed to know? How am I qualified to know? Will you come and speak to our solicitor?
I can't.
Why not?
I'd lose my job. I can't. I'm sorry, Mark.
Why won't you help us?
A patient died because of a mistake that I made. Put me in the witness box. That's the type of doctor they're going to show me to be. I'm of no help to you. I'm sorry.
On with the show.
Hello. Don't worry.
Mrs. Drake, possible ectopic. Ultrasound shows a lot of free fluid in the pelvis. Probably significant internal hemorrhaging.
How long?
Plenty time.
We're ready. when will you be?
Soon.
This isn't a spinal, this is a GA.
Huh?
A GA. Oh, for fuck's sake. Lost half an hour dicking around with the GA.
So we lost half an hour. Just let me think. Retraction. Yeah, more retraction. Thank you. Spencer Wells.
Boss. Boss?
Rob, will you shut up? I'm trying to think. Oh, shit. Getting that suction.
Hold on, Ned.
Can you see it?
I can't see it.
Okay, let's clear the field so we can see the vessel. What's her blood pressure?
She's got it.
Huh? I don't understand a fucking word you're saying. Will someone switch the music off, please?
I think I've got it.
Yeah.
I've got it.
Good. Good work.
Boss, this isn't working. Maybe we should extend the incision, boss.
Rob, will you shut up? Either do it my way or get out. Oh, shit. Suction. You're in my way.
Mr. Whitman, I need you to come to Theatre 12 right away, please.
I've got my own list here.
Mr. Whitman, please.
I'll be fine on my own for this first one.
Is Roger coming in?
I am.
I cannot take another consultant's case.
I've got a patient on the table in there. If Hurley carries on the way he's going, she's going to be dead in the next 10 minutes.
Patients die.
Not this one. She's an ectopic, she's bleeding heavily, she still stands a chance.
Really, Tony, I'll be fine.
Shit.
Oh, shit.
Rob here's not feeling very well, do you want some?
Yeah, thanks, Tony. I might need you for a minute or two.
Let's have a look, shall we? She could be bleeding from the ovarian artery. What do you think? Clamp it twice, take it from there?
Yep. Thanks, Tim.
She's gonna be fine, mate.
Which is more than I can say for you.
Next time on Bodies.
Things may be about to start to get difficult for me around here.
You're a management poodle. A poodle pulling a little gay trolley.
He went to Whitman. What's to say he won't go to management?
I'm not going to go to management. What's between doctors stays between doctors.
Maybe now you'll understand the damage you've done.
Why did you let Early do this to me?
Why won't you help us?
It's the system. Reject it. You're on your own.